coughing up blood. I had to get an ambulance, which my guide recommended coming to this private hospital. Riedl from Australia. I arrived about 9 days ago to India and did some travelling, which we have enjoyed. 5 days I started to experience some severe pain early hours of the morning in my back, which led to difficulties breathing, and then I was coughing up blood. I had to get an ambulance, which my guide recommended coming to this private hospital, which was wonderful. He arranged the ambulance for me and we were delivered here, which I went to emergency first and got the care, and they diagnosed that it definitely was a lung issue. And then I was brought to ICU with further tests done, x-rays, a CT scan, and then it was found that it was pneumonia in the right lung that was causing a severe problem with quite a bad infection. They started the IV antibiotics, and that started to relieve the pressure I was feeling. I've been in 5 days and feeling 100% better, so it's all worked. The nurses have been great. The doctor has spoken to me and explained step by step what was happening, and I understand which medications were and what I was receiving, which was really good. Yes.
Good evening, everyone. Myself, Dr. Siddharth Tomar. I'm a practicing pulmonologist in Pushpanjali Hospital, Agra. So recently, I treated a patient from Australia who was visiting India for traveling purposes. And during her visit, she developed acute respiratory complaints of right-sided chest pain, grade 4 dyspnea on exertion, on and off fever, cough. With these complaints, the patient presented to us. We were able to admit her under my care, and in Pushpanjali Hospital, we were able to promptly come to a diagnosis of right lobar consolidation, which is a community-acquired pneumonia, and promptly treat her in an appropriate manner. Now we were able to discharge her in a stable condition, and I hope her safe journey return back to Australia